Zurich just really, he loves coming. The lab is actually his favorite place to go, besides the playroom. If you were to say, do you want to see the doctor? Do you want to go labs? Labs. He doesn't care. He walks right in, gets on the chair or the table, pushes back his sleeve, here it is. He has no ill feelings about getting his labs drawn.
My time with Zurich goes all the way back to 2010. Shortly after he was born, he was noted to be jaundiced, and as a result of his workup for that jaundice, we came to the conclusion that he most likely had biliary atresia. So look to the left. I took him to the operating room to confirm that diagnosis, and we were very successful with Zurich.
And it was a very scary experience to come in and know you're going to hand over your precious bundle, and you don't know what's going to happen. Here at Children's, they do something that's really wonderful when your child's in surgery. And it's very important. They send a provider out every 30 minutes approximately to give an update. I don't know how I would have made it without that. It was like the only lifeline that we had to Zurich for those hours and hours and hours that he was gone.
Early on, whenever I'm having an interaction with a family, I try to get information about the whole family, because it's not just the patient that we're dealing with, it is the entire family.
No, it's for that.
We always try to be part of that family. How you develop that trust is the key thing. And it doesn't happen right away for everybody, you know, exactly because of the fact that people have different personalities of how they use things. But you have to understand the family needs, and that's the tricky part.
Now I'm it.
What Dr. Abdesalam did was allow our children to be still with me and their sibling instead of being out of the loop and creating a whole nother level of stress for myself and them. And that holds a special place in our hearts forever. Sarah in GI is wonderful. Her personality is wonderful, and she'll listen to details, and you know, you're giving her lots of information and she keeps track of it all, and she helps sort it through one at a time, and we'll go back to the team and calls back with the plan.
Well, it's right because it's right. It's right for the family, it's right for the patient. Putting everything together, I know that they're not going to be in the hospital all the time. They're going to go back to the family unit. I need that family unit to be as strong as possible in order for the patient to have the best outcome.
Take some out.
If we can identify those needs and make sure they're being met while they're here in the hospital, then I think that transition to home should be much better.
What we want to be sure is that the parents feel comfortable with what is happening. We always try to develop the environment where they can ask questions. And sometimes we understand we fail doing that, but you know, that's part of the things of the learning process. Sometimes parents are different. They need a little bit more time to digest things and then come back with questions. And we always want to leave that opportunity open for them.
To the mom, nothing's routine. An x-ray is not routine, a blood draw is not routine, because you never know what the results are gonna be. And when you already have a child that doesn't fit the mold, even in the mold of their own disease, you think twice about things. And to be allowed to do that is really wonderful.
And once I've operated on a child, they are mine. I mean, they're my child. I really take that to heart. I firmly believe that. And if that comes across that way, I think it gives a lot of comfort to the families.
Hi, I am Dr. Ruben Quiros, and I am the patient experience.
Hi, I am Dr. Shahab Abdesalam, and I am the patient experience.
Hi, I'm Angel Sherwinski, and you are the patient experience.